It is with great pleasure and gratitude that I address you as a President of D-Food International, based in Belgium, for biennium 2023-2025. I feel extremely honored and privileged to hold this position and the responsibilities that come with it. D-Food International is an organization consisting of people working in the field of diabetes-related food complications. These people are spread across 7 regions: Sub-Saharan Africa, South and Central America, Middle East and North Africa, North America and Caribbean, Europe, Southeast Asia, and Western Pacific. All are dedicated to providing preventive food care for people with diabetes through awareness, education, and professional guidance. We are all aware that global diabetes epidemic is projected to rise. Low and middle income countries are expected to have the highest prevalence of diabetes, particularly in Sub-Saharan Africa, which is going to hit hard and is expected to increase by 134% in next 20 years. As diabetes rates rises, the incidence of diabetes complication will also increase, and one of the dreadful complications of diabetes will be food-related complication. It is already known that every 20 seconds a diabetes limb is lost somewhere in the world. Let me tell you about D-Food International mission, goals, and focus of action. Our mission is to promote the goal profile of diabetes with food problems, prevention, care through awareness, guidance, education, research, and professional development. To push D-Food International mission, ending avoidable lower limb amputations due to diabetes worldwide. Our goal is to prevent and reduce number of unnecessary amputations from diabetes worldwide and improve the quality of their lives. Our focus of action is training the healthcare workers, focusing on the grassroots level, how to manage diabetes-related food problem effective and prevent amputations, giving healthcare workers strategies to implement, develop, and very important, sustain the food services in their individual countries. Promoting and recognition of diabetic food specialists globally, closing the gap between available and affordable diabetes food care. To identify people with diabetes who are most at risk of getting food complications, healthcare workers should be able to examine patients' feet. Prevention is greatly aided by education. Education plays a vital role in prevention and should be simple and repetitive. Healthcare providers, patients, family, relatives, and friends should be targeted for education initiatives. In my capacity as President, I pledge to actively champion diabetes-related food complication management in a financially friendly and accessible manner. My primary focus will be on low and middle income countries to further push D-Food International mission, goals, and focus of action. As I always say and would say it again, education is the only powerful tool we have, especially in the developing world, which is free of charge for the patient and effective if implemented properly. Encourage programs dedicated to highlighting diabetes food care complications management in the context of financial limitations to promote affordable universal health care. I believe that we need to recommence the project carried out aiming to help people with diabetes who are economically less fortunate. We have a moral and ethical responsibility to give back to the community and help those who are vulnerable. In the coming months, we'll be focusing on several important key areas. This includes further enhancing our education resources, such as our flagship project, Train the Food Trainer course or Train the Food Healthcare Workers, Diabetes Awareness Week in the month of November, which starts from 7th to 14th November, webinars, several other projects to equip healthcare professionals with the knowledge, skills for excellent patient-centered care. All that has already been arranged and will be covered in next 2 years during my term. I deeply encourage each and every member of D-Foot International to actively engage in the activities, openly share expertise, and contribute to collective mission of D-Foot International. Your unique perspective, insight, and dedications are invaluable to those affected by diabetes-related food complications. Together, we have a power to make a difference. Let us collaborate, inspire, and transform the field of diabetes-related food care. Thank you for your support and commitment to our shared vision. Thank you very much.